This month, we are celebrating Refined Dermatology's 4th anniversary. I'm really excited about it. And I wanted to share a little bit more of our history with you if you don't know our history. So my husband and I moved to Knoxville in 2020, and I had worked in private equity in Florida and had worked a little bit here with private equity and just felt like something was missing. I didn't feel like I was getting that personal touch with my patients, and I really wanted to have something that aligned with my values. And so after a lot of prayer in 2022, we opened Refine Dermatology. And I say we because my husband, Andy, is an integral part of this. He has a background as an entrepreneur. He's opened several businesses, and his wisdom, his knowledge, his perspective is all over this place. And our vision really was, yes, have great medical care, but also to have a great patient experience. We wanted care to be on both sides of the wall from start to finish. And that really is reflected in our mission, which is exceptional skincare and exceptional experience. We have worked really hard and been very intentional about the way we have built this team here. And we feel like everybody here really aligns with our values, which I think is what makes Refined Dermatology so special. We opened our first week with a handful of patients, most of which were either related to me or already knew me. And we have grown into this incredible practice with this huge team of 15 now, with 2 amazing PAs that now are helping me extend patient care even further. So I just feel grateful to the patients, to the staff, and I just feel grateful that we can provide care in this area, in this community. And so I feel blessed to be part of Refined Dermatology, and I'm thankful that you have been part of our story. This month, I'd like to do another patient case study.
I've started to notice my hair getting thinner, especially along my part. It just doesn't feel as full as it used to, and I feel like I'm seeing more of my scalp. I don't know if this is just part of getting older or if it's something I can treat. Do you have any treatment options for this?
So this patient is experiencing something called androgenic alopecia, or female pattern hair loss. This is an extremely common form of hair loss, and it's actually the most common type of hair loss in women. And they say about 50% of women will experience this at some point. It's really characterized by kind of a widening of the part, thinning of the ponytail, or seeing more of the scalp. And there are a lot of things you can do to treat it. So the first line therapy for this is topical minoxidil, or Rogaine is better known. And it is effective, but you do have to be very, very consistent with it. If you don't use it consistently, it doesn't work. Next, we'll often use low-dose oral minoxidil in place of it if patients are having a hard time with consistency. I find that patients have a little bit better time taking a pill every day than they do applying a topical consistently. Next, we can use hormonal therapies that block hormones causing the hair to fall out. Things like spironolactone are helpful in decreasing the amount of shed. And then we do have some in-office procedures that we can perform, things like platelet-rich plasma, PRP, or platelet-rich fibrin matrix, PRFM, where we actually inject your platelets into your scalp to kind of stimulate hair follicles and to improve the hair density. Overall, there are a lot of treatment options for androgenic alopecia, and the key here is to make sure that you're treating it early. The earlier you treat it, the more likely you are to be able to keep your hair and improve hair growth. This month, I also want to talk about adult acne, and you can find some more information on our blog this month. But adult acne is extremely common, and we kind of think about acne as dying after our teenage years, but I do see hormonal acne, adult acne, primarily in women in their 20s, 30s, and beyond. It's characterized by acne along the jawline, the chin, and often the chest or back, and it's caused more by hormones than anything else. And a lot of times the over-the-counter treatments just really are not effective at treating female adult acne, and so it can be frustrating to try to treat from the patient's perspective. I often like to use prescription topicals like retinoids, which are the mainstay of treatment for acne, as well as some topical anti-inflammatory things like azelaic acid or even dapsone. I typically will even use some hormonal therapies like spironolactone to help block the hormones that are creating the acne. Overall, it can be really frustrating to be dealing with acne in your 20s, 30s, and 40s, but there's a lot of treatment options. They just tend to be more prescription-based. So if you're not able to control it with over-the-counter options, it would be a good idea to see a professional.